What is up, everybody? Welcome back to the channel. Welcome to Main Street Fire Rescue. It's Matty, and I am gonna officially place this vlog in service as of right now, Monday afternoon, August the 12th. I decided that I had to stop my parks vlog I was doing with going to the locations of all of the new announcements from D23 this weekend. We got a really bad thunderstorm that kicked up just like I said it was going to, and so we're just waiting for that to pass. I thought, well, how can I make the best use of my time here? I got everything else I need to get done, got the workouts done, got everything else done. What can we do? I've been wanting to talk about a specific subject for a while. Let's get that done now. I can get it uploaded, get that started, and then tonight I can finish the one I started this morning, and then we just keep things moving right along. So, what are we going to talk about today? This vlog today is for anybody out there watching. If it's you or if it's anybody you know that might be on blood thinners, this vlog is for you. As long as I've been in emergency medicine, which is 18 years now, to me, just from personal observation, there is so much limited information that is out there for people. People know nothing about what they're taking. I ask people that a lot, actually, when they come to the emergency room, or when I used to show up at their house on the ambulance or fire engine, and they'd have problems. I'd always ask, what medicines are you taking and why? Well, I'm on blood thinners, but you know, some people have said, I'm not sure why. Or I take baby aspirin every day, I'm not sure why. Or I've asked people if they've been on blood thinners, and they say no. And I'll say, well, do you take any baby aspirin at all? Yes, that's a blood thinner, people. That's still a blood thinner. It might not be Eliquis, but you're still thinning your blood out every day with aspirin. It's not good to do that, I can tell you. There's a lot of drastic side effects that nobody talks about. And, you know, various people get put on blood thinners because they've had, you know, either potential heart attacks, or they've had one, or they've had a potential stroke, or they've had a stroke, or they've had blood clotting in the leg or anywhere else, and so then they get put on blood thinners, and most of the time it's for the rest of their life with no off-ramp at all. I've been reading a lot of research lately that says that's probably not the best of ideas to be doing that to people. A lot of this research is coming from overseas, not so much here in the States, but there was one interesting study, I thought. What the results were, I can't remember the name of it, but they put two cohorts of people, and they followed them for a couple years, and they were, you know, one was on blood thinners, one wasn't, and there really wasn't that big of a noticeable difference between the group that was and the group that wasn't. But the people that were on them had really bad side effects, and really bad, basically your body disintegrates. And what pisses me off is these doctors put these patients, young and old, on these things for various reasons, and at no time do they ever sit down and use that little wheeled chair that sits in the doctor's offices or emergency rooms. That chair is for teaching people. You know, doctor is Latin for teacher. Paramedic. Para is before, medic is doctor, Latin for doctor. So, we're the before doctors. It's still my job to educate people on what I'm doing, why I'm doing it, how come I'm doing it, and what they may feel because I'm doing what I'm doing, if that makes sense. Constant communication is key. But these days we don't do that. These days people go into their doctor's offices for whatever reason, or they have procedures done, and they're handed a whole bunch of prescriptions, and take this. Take them forever. And nobody questions it. And what really gets me sometimes is when people show up in the emergency room or doctor's offices or anywhere else, and they have a problem, not once is it ever mentioned that it could potentially be the medicines they're taking. Like, that's not even part of the thought process. And to me, that's kind of screwed up when you think about it. That we don't ever consider that. So where I'm going with this is, there's a lot of people on blood thinners out there, and almost none of them know how to manage themselves while being on them, and almost nobody ever thinks to ask their doctor, hey, why am I on these for the rest of my life? What's the benefits? What's the risk? What's this going to do to my overall health and my body over the next 10, 15, 20 years? Nobody asks those questions. They just do it, and it just, I don't understand it. You know, I really don't think that we were meant to have our blood thinned all the time like that. I just don't think that's good for us. You know, they say, oh, well, it could save your life because it'll prevent another stroke, it'll prevent another blood clot, it'll prevent whatever. How do we know that? What's guaranteeing that by thinning the blood? What about the other stuff you're going to cause? All the bruising, all the skin tearing, because it turns your body to tissue paper, because you cannot constantly thin the blood without drastic side effects. You know, and where I'm going with this is everybody loves to travel, everybody loves to do things, everybody loves to go on vacation. And a lot of people that I meet in the emergency room are on vacation, and a lot of them are on blood thinners. And the reason they wind up in the ER is because they wind up with some kind of cut. Whether it be accidental, or they brushed up against something, or it happened because their body's thinning out. You know, I've seen it where people, I see it on airplanes a lot, or people that get off airplanes. We'll talk about that in a minute, where their body just starts spraying. You know, a little hole gets poked in the side of the leg, and blood just starts coming out because everything's so thin. And they always come running into the emergency room because, like, I can't get this bleeding to stop. And then I feel like it's my job to educate people on what to do if this happens again. Because what if you're not near an emergency room? What if you're not near anywhere that can get help? And let's face it, with fire rescue, police, and even emergency rooms, everybody is so low staffed these days. It might be a while before help gets to you if you're far, even if you're in the city, you're not guaranteed that help's going to get to you right away. So we really need to start taking care of ourselves here. And this is where I feel like it's my job to educate everybody on this stuff. So maybe this might help you, or it might help somebody you know. So, first things first, if you are on blood thinners, and again, doctors should sit down with you and talk to you about these things and what to do if you have a problem. I know they don't, so that's what I'm here for. This is something that everybody should carry with them on their person, meaning within an arm's reach at all times. This is a hemostatic dressing called QuikClot, okay? This comes in this little silver package. It's just that. It's a little dressing. It's a 4x4 dressing. It's made out of, it's got like, what do you call it? It's shellfish, basically, because shellfish, kind of the grounds of shellfish, they act like clotting mechanisms that are in our blood, our platelets. So that's what's on here. And there's some other things in there that help the blood to clot. I'm telling you, this could save your life someday if you're nowhere near an ER, hospital, doctor's office, or if ambulance and fire or the police department's far away from you. What you do is, if you get cut and you start bleeding, you take this out of the package and you slap it on and you hold it tight and you put a lot of pressure on it, and this will stop the bleeding within 5 to 10 minutes. And if it doesn't stop the bleeding, or it slows down but it's still bleeding, you take another one, put the next one on top of that, and so on and so forth until it stops. But basically, you've got to give each one about 5-ish minutes or so to see how it works. Don't take the other one off, just keep piling them one on top of the other, and they'll all work together, okay? But I cannot stress this to you all enough. Now, how important these are. Now, these are from the emergency room. I carry these on my person. These are in my uniform. I have these ready to go in case a patient comes in that needs this. You can buy these on Amazon, okay? This is on. You can buy it under Amazon, under QuikClot, under, if you just put hemostatic dressing, whatever you want to put, you'll find it. And a lot of times you can get these things in a small little trauma kit that you can keep close by yourself. The trauma kits are a lot like these little things, okay? This kit has got everything under the sun in it. Like I said, this is an advanced kit. Most people aren't going to need this. This is set up for a paramedic, like for myself. Okay, I've got things in here that can be used for if you're out in the wild. I've got fishing supplies in here. I've got things that you can start a fire with in here. I have an emergency blanket. I actually have 2 of those in here. I have supplies for, I have a whole bunch of these that were included with this in here. I've got a bunch of 4x4s and bandages. You can see right here, there's a couple of light sticks that are in here for nighttime. I mean, there's a small compass. There's an all-purpose tool in here that you can cut. It's got screwdrivers. You got paracord for, if you need to, whatever you may need, paracord for, which is very strong. It's really nice to have at a moment's notice if you need it to tie up anything or hoist something, build something, whatever it is. It's great to have. Some other things in here. There's a multi-purpose knife. There's all kinds of things. This is not something you're going to carry with you on an airplane because of the tools that are in here. This is not going to pass through security, okay? What I'm talking about is you get something like this that's smaller, that has all of the dressings in it and all the 4x4s, and it's called a cat tourniquet. I also have one of these in here. It's tucked way deep inside of here. A cat tourniquet, if you're not familiar with, it's basically just that. It's a tourniquet you can put on a limb, an arm, leg. Don't put it here. Come on, just being silly. Put it on an arm, a leg, around here. If you have this is not something for a regular bleed though, okay? This is a tourniquet's for a severe bleed that you cannot get to stop. You've tried the pressure, you've tried everything, and it's not stopping. That's when you put that sucker on and you crank it down. What I find amazing is the tourniquets, when I went through EMT school in 2006 and then paramedic school in 08, I find it amazing that the tourniquets were the last line of defense. That's what they said. You never use a tourniquet unless it's life and death. Now, it's being considered as one of the front-line pieces of equipment if you can't get blood to stop within a few minutes. It's interesting how that all changed around. But like I said, you can get these on Amazon. You can get them in sporting goods stores. You can get them anywhere. If you're going to travel, like I said, don't be trying to go through TSA with this thing with knives and everything else in there. They're going to probably slam you up against the wall and question you, and you're probably going to miss your flight. But you can have this stuff in there. You can have a tourniquet. You can have all your 4x4s. You can have pretty much anything you need to be able to take care of yourself. All right. Now, if you're driving in a car, whole different story. Okay, you can do the full fit. You can do the full kit. Just know how to use this stuff. There's nothing worse than people buy these kits like this, and it comes down to they need to use it. They don't know how to use anything in here. If you get this, break it open and practice with it. Learn how to use this stuff. A lot of this stuff is multi-use. You can use it over and over again so you can practice with it. Some of it you can't, but a lot of it you can. The one thing that I added to this, again, advancement. This is very advanced in this kit. I taught myself how to do my own sutures, so I have my own suture kit in here. Suturing, unfortunately, is not part of the paramedic skill. I could actually see it go in that direction at some point, but it's not, so I decided to teach myself, and that way later on, I would love to go back to school for either physician assistant or nurse practitioner. That's going to be part of the skill set, so already a step ahead there. You can also even throw your medications in there. Again, keep it on your person. Don't put your medications in checked baggage. My gosh, people, I cannot tell you. That's a whole other topic for another day. We'll talk about that at some point, because this vlog will go on for half an hour if I get going on that one. But please don't put necessary medications into checked baggage. I can't tell you how many people turn up in the emergency room and they're from either out of state or they're from out of the country, and their medicines are lost because the luggage is lost from the airline, or the airline lost the luggage. They have no medicines. This is medicine they need to take every day. These people are in a panic. So please keep your medicines on your person in your carry-ons if you're flying. Even if you're driving in a car, keep them nearby you. Don't go throwing them somewhere where they could get lost or misplaced. Keep them nearby you. Jeez, please, people. But anyway, back to the blood thinning stuff. This is really important to have close by you if you're flying. A lot of people don't realize being on blood thinners and flying is a really bad combination. Why is that? Because when you fly, once you pass 10,000 feet, everything in your body expands. It's the laws of physics. When you dive under the surface of the water, things shrink down. When you fly up in the air, things expand. It's the complete opposites. And having been a scuba diver and having been skydiving, I've seen it on both sides. People, if you're on blood thinners and you're flying, you have to have this stuff nearby, because so many times I have seen people come into our emergency room after landing at Orlando International Airport with some kind of bleed that happened. Usually it happens while landing, for what, you know, because the pressures are starting to change again, and a lot of times it's in the leg, and like I said, you just get a weak spot and a vessel breaks, and the skin's already thin enough, and it breaks through, and next thing you know, you got a vessel bleeding, and they can't get it to stop. And then they come into the emergency room. How they get to our emergency room from all the way from MCO, which is Orlando International, I'll never quite understand that, because they pass like 4 or 5 others on the way to us. But different topic, different day. We're happy to help. Always going to help people. But it just amazes me how they get all the way from the airport to our place. But I've seen people come into our lobby, you know, legs just wrapped in towels, or just soaked in blood because they can't get this bleeding to stop. And then I come out, you know, like draw this stuff out like John Wayne, you know, out of a holster and slap it on, and we got the bleeding controlled in about 5 to 10 minutes. But anyway, back to the blood thinning stuff. Y'all, please keep this stuff close by you, okay? And again, talk with your doctor. See if there's an off-ramp for this stuff. You know, I can't tell you how many people I've seen that have been on this stuff for some even decades, and they never think to question the doctors. Like, hey, when can I maybe come off of this? Or is this really a good idea? You know, I've even seen it where, you know, it happens all the time with paramedics. You start an IV on some of these people, because I have a special technique that I use that, you know, I hold the arm. It's hard to see, but I hold the arm like this, and I use my thumb to pull traction on the skin, and which keeps the vein in place, and the veins don't move around. It's a fantastic skill to have, because everybody always says, "Oh, my veins roll." Well, and my response is, of course they do. You're chasing a round object with a sharp round object. Of course they're going to roll. You got to hold them in place like that. But when you do that, if you do that and you're not careful with somebody that's been on blood thinners, you'll deglove their entire arm. You'll just tear the skin like tissue paper. So you got to be very careful. And doctors really can't stitch that because the skin is so thin. They can't stitch it. They just tear it. It's horrible what blood thinners do to people. I hate it. I really hate it. And again, I've even asked myself, I'm like, is this really worth it? Is it turning people into basically tissue paper? Is that worth it? What's their quality of life like? What would it have been if they hadn't have done this for, you know, all these years? Would they still be fine? You know, but we won't do research like that. So you have to, you know, rely on other countries that are starting to do this, and they're kind of like, I don't know if this is a good idea or not. You know, there's still more that's needed, but the more and more things that are done, it's starting to point to probably not the greatest of ideas to be thinning your blood all the time. But again, another topic for another day. As of right now, anybody watching this that's on these, please, again, I'm going to say it one more time, keep something like this and a bunch of 4x4s, or you can even buy those thick, they're like trauma pads. Keep that stuff nearby you, because you never know. Like, even walking off an airplane, your leg could catch one of the seats as you're leaving, and you could just tear the skin, and now you've got a bleed that you've got to stop. You know, or you could be outside walking. A simple trip and fall can really be bad. Or again, catching your leg, catching your arm on something, tearing the skin, causing a small puncture wound. It's going to bleed like crazy until you can get something to stop it. So again, right here, Quick Clot from Amazon. No, I'm not sponsored by them, but I've seen it work many times, and it is fantastic. I hope you all got something out of this. If you have any questions, ask me down in the comments. Again, I'm not a doctor, but I am a paramedic. I have a lot of experience with a lot of things here, especially with what I'm just talking about, and I'm happy to try my best to answer any questions you may have. You know, your doctor should be able to explain why they're doing all of this and why they're putting you on these particular meds. And honestly, I'm a firm believer that our bodies were never meant to be on this stuff permanently. Like, I always think that our bodies best function as it's meant to be by, you know, God who created us. You know, but the more and more we start messing with things, I feel like we're just entering into a whole nother set of problems. So, you know, if your doctor's not willing to talk with you, or they just say, you know, well, that's just how it is, you know, make your own decision. But sometimes, to me, that'd be the sign for a new doctor, because any doctor should be able to explain the how, the why, and the what for. Automatically, you should be able to do that. The doctors have pharmacology training. I have pharmacology training. You know, I love pharmacology. I'm fascinated by it, and I study it endlessly. And honestly, I think I know more about pharmacology than most doctors do. But, you know, I still think there are a lot of dangers in being on blood thinners a long time like that. I've seen it. You know, I just hate what it does to people. So, for the time being, if you're on these things and you're going on vacation or you're doing anything in or outside the house, keep what I told you nearby you. I promise you, if something happens and you need it, you will thank me. It's nice to have. So I hope you all got something out of this. And again, if you have any questions or whatever, leave them in the comments. Give us a thumbs up. It does help us out. Thank you all for your engagements in my other vlogs. The Halloween one's doing well, and yes, to the one person that left the comment, Halloween is one of the best times of the year at Magic Kingdom. I highly agree. It's fantastic. Christmas is even better. But Halloween is fun. Lots and lots of cool stuff coming up, and we'll be heading back out to the park shortly to work on the second half of the original vlog today. So thank you all for watching. If you like all this, give me a subscribe. There's lots more to come. I'm going to try to do this about at least 3 times a week right now. If I'm able to do more, we'll do more, but at least for right now, we'll try to get uploads at least 3 times a week. Have a fantastic afternoon, everybody. Main Street Fire Rescue, out of service. This has been the truth, and it's been actual, and hope for everybody out there, it's been mighty satisfaction. I hope you got something out of this. See ya.